All right. Good afternoon, class. So we're going to talk today about another great sedative drug. And there's a lot of services around these areas that use it. It's not really used in the Marion County setting, but it's used in other places. And so with that in mind, we're going to talk about etomidate. And etomidate is a very short-acting sedative hypnotic. It has a lot less effects on the blood pressure, which is why a lot of people like to use this for when they do an RSI. And we're going to talk about the goods and the bads and why you should use it, or maybe why you shouldn't use it. And there are some cases where you don't want to use it. The other name of it is etomidate. Again, it's specifically used for endotracheal intubation. We use it along with succinylcholine. It's a quick, I would say, a quick attack to knock out to sedate your patient very quickly. It onsets really quick. The problem is that it also wears off pretty quick. So again, if you miss the intubation, it's kind of a good thing. It wears off a little bit faster. The bad news is that if, of course, you get the intubation, now you got to start thinking about long-term sedative effects. And again, we use it again as an adjunct to general anesthesia. So again, this is kind of way, this is the 1-2 punch. Either, one more chance to stay still and behave. Again, it facilitates, it uses the GABA receptors. Again, it kind of displaces those and inhibits that binding. So again, you have a nice sedation to it, little effect of hypnosis as well. And again, it transient 20 to 30% decrease in cerebral blood flow. So you got to be aware of that. It kind of decreases that a little bit. So again, the effects are partially due to the depression of the brainstem. And again, it's a hypnotic without the analgesic properties. It does nothing for pain. Again, it's only to make them forget what exactly you're doing to them. Great stuff about this is that 30 to 60 seconds, this stuff onsets. Matter of fact, there's been a lot of patients before I've given Versed to, and it really didn't affect them. And then I used etomidate, and then it worked great. So I don't know if it was kind of the combination action, or if it's but most of the time when you give an etomidate a dose, it usually sedates them really well. And again, 3 to 5 minutes. It's a very short acting. So again, it immediately onsets. It's very short acting. And again, we use it to facilitate endotracheal intubation. So again, you're going to get you may get some trismus because of it. You might get some muscle rigidity because of it. That is one of the side effects, is you'll get a reflex skeletal muscle movements with it. Again, the blood pressure, it can go either a little bit higher or a little bit low. And most of the times, but the hypotension is not near as bad as, let's say, with a Versed or Ativan. So again, you might get some respiratory depression with this. Again, one of the problems with giving it is laryngospasm. It can cause a little bit of nausea, vomiting. It's usually because, again, for the blood pressure. And again, if they got any type of adrenocortical dysfunction or they're pregnant, we stay away from etomidate. Again, a lot less side effects to that. And again, if they've got some liver disease, it's processed in the liver, so we kind of want to give that very cautiously to those folks. One more that is not in here that probably should be is if the patient has sepsis. You really want to stay away from etomidate with sepsis. And the reason is it can cause profound hypotension with that, and the patients have a very worse outcome if they're given etomidate when they're in a septic state. So try to stay away from that at all possible. All right. So again, you got to be careful with the antihypertensive agents and etomidate. Again, you can drop a blood pressure pretty quick. So again, our older folks in the area, they're probably going, oh yeah. Again, septic patients, you need to avoid the etomidate. And again, if you push this stuff quick, that's when you get the bad side effects. So do it slow. This is 1 to 2 minutes is how long you should take to do this. The range of this, here's the cheat way: 20 milligrams of etomidate. And if you look at the range, 0.2 to 0.6 is the range. And again, 0.3 is kind of the quote-unquote protocol dose. But again, if you kind of do the math out, if you use 0.2 to 0.6, it works out to be 20 milligrams of etomidate. kind of a common thing. 20 of etomidate, 100 of Sux. And again, pediatric patients 0 to 2 to 0 to 6, just remember they don't have the GABA receptors. So if I was going to miss on that one, I would miss more towards the high side. Again, we give it IV or IO, and again, it will cross the placental barrier, so it can cause fetal damage. So be careful when you're using it with the pregnant folks. Again, weigh out your rest spurts and benefit there. And with that said, that's the end of etomidate. Again, speaking of that, again, your choice whether you want to use Versed as your ketamine or etomidate. Anytime you got a patient, obviously, with low blood pressure, you kind of want to stay away from the Versed. Etomidate is a better choice. And again, ketamine, if you're allowed to use it, is an even better one if they're hypotensive. So that's kind of the guidelines I use. But the other thing you got to remember is once you get the blood pressure up a little bit, you need to go ahead and give them a benzo if you're giving them ketamine. So just to kind of be aware of that. All right, guys, we'll talk at you next time.